All right, everyone. Welcome to the Doctors and Dollars podcast. I'm your host, Nate Crannell. Guest today is Dr. John Santa Anna. John is a board certified in PM and R as well as
Yep.
electrodiagnostic medicine. He is a physician specializing in interventional sports, joints, and spine treatments. He received his medical degree at the New York College of Osteopathic Medicine and his specialty training in PM and R at the Walter Reed Army Medical Center in Washington, D.C. He is a veteran and was a physician in the U.S. Army, treating our nation's heroes, musculoskeletal conditions, and getting them back into the fight. He now spends his time treating both sports-related injuries and everyday injuries at the Michigan Center for Regenerative Medicine in Rochester, Michigan. Dr. Santa Anna, welcome to the show.
Thanks. Glad to be here. Thanks for having me.
Yeah, so the question I always ask people first, what's going well today for you?
Everything. So things are good. Today I had a pretty busy clinic day yesterday. Today's my admin day, my hump day in the middle of the week. So smooth sailing from here on out.
That's awesome. Tell me about a busy clinic day. What is that? How many people are you seeing? Time in, time out. What's that look like for you?
Yeah. So usually we do about 15 to 20 consults a day. So not too busy. We do spend a lot of time with our patients. Just the way that our practice is, we're a hybrid insurance and cash-based practice.
Mhm.
Especially with the regenerative medicine, there's a lot of explanations that we have to do with patients as far as giving them options. So we pride ourselves in spending that time in being able to know your patients, being able to, find the correct diagnoses, and then giving them treatment options from, something that insurance will cover and to other things that insurance might not cover, but may work better for their particular condition. So it's a really nice practice that we created. It's a very casual, friendly atmosphere, and we like having our patients part of the whole process.
Love that. So patient care is at the forefront, but you're not turning and burning, right? It's not
No,
15 minutes
no,
in, we'll give you something and you're out. Yep.
right, right. That used to be my life for a really long time. Unfortunately, that's kind of like how the medical system is built. But we consciously made an effort that if we're going to do this our way, we want to do it the right way that we feel is going to be the best for our patients.
Yep. And that's awesome. I mean, I've met doctors that are doing, 6,000 visits in a year, which is
Yeah.
an unbelievable number. So to have would you say 15 or 20, that's pretty good. It allows you to spend some quality time with them, get to know them a little bit personally. But also, like you said, I mean, you nailed it. Sit down and truly explain what their options are and allow them to make a good informed decision.
Yeah, absolutely. It's been a blessing. It took a while to kind of get to this point, but patients are receptive to it. Like everyone wants to be listened to, and just being able to hear them out and find out what the root cause of the problem is, and come up with a pretty good, neat solution is it's actually a very rewarding.
That's awesome. Well, I read the bio. You've been all around. Within that, though, I want to start. What's the genesis of John? Give me the nuts and the bolts? Where you started, where you grew up, what drove you to become a physician?
So I have a pretty interesting kind of probably not your common route to where I am. So I was born and raised in the Philippines.
Okay.
So grew up there. When I was younger, my dad ended up getting a job here in Michigan. So he's an engineer, and pretty soon later we followed him here to the U.S. And then kind of moved around different states for a little bit, and then finally settled back here in Michigan. Ended up going to undergrad here at Wayne State University. It's a local university here in Detroit. When I first got into college, I wasn't really sure what I wanted to be. I kind of knew that I was kind of good in science. That kind of interests me a little bit. I did like the whole area with finances and maybe being going into business or maybe into law. So it's kind of like just a very liberal artsy type couple of years in undergrad. But I still did a few pre-med courses, right? Because like I kind
Hmm.
of back in my head, hey, this might be what I want to do. And I spoke with one of my counselors. He mentioned like, hey, you should go be a nutrition major because you could kind of take nutrition classes. It's really interesting, but at the same time, knock out your pre-med classes. So I did that. Met a couple of friends who are going into medical school and just kind of hung around with them and later on took the MCATs, passed, and applied for medical school, got in. So it's kind of one of these things where I kind of knew in the back of my head that maybe medicine is the path for me, but I wasn't gung ho medicine. But once I got in, I was completely all in.
That's
Um,
awesome. I mean,
so
they
yeah,
tell you, they say, surround you are the five people that you surround yourself with. So it sounds like you found some good apples there in college that said, hey, let's do this medical thing. Let's go take the MCAT, and see where it goes from there. And then that's
yeah,
awesome.
yeah. It was just kind of serendipity, I guess. It just kind of happened. But I just kept going at that point. I got into medical school, ended up going to the New York College of Osteopathic Medicine in New York. I figured like my chance to actually live in the Big Apple, right? If you make it
Yeah,
there, you can make it anywhere. So I did that, made a lot of really good friends. I had a really, really great time in medical school. I mean, medical school is hard. I mean, everyone will tell you it's one of the hardest things you go through, but you make lifelong bonds there because of all the difficulties that you guys go through. And it's also pretty fun, right? You got to have that. You got to have that sense of you got to enjoy what you're doing and your point in life wherever you may be. Had a good time there. And then while through medical school, I kind of the show was a big thing back then. So
sure. Yeah,
everyone in my generation wanted to be an doc, right? Save lives. So I kind of just gravitating towards So I kind of knew I think it's what I wanted to do, but it's I also thought that I like sports. I used to play a lot of sports. I'm more of a weekend type recreational sports guy, but
hmm,
like while I'm on the court, I'm Michael Jordan, right? So that's how
sure.
everyone thinks. So I like that part of it. So I always kept active. So I always thought maybe orthopedics is the way to go, right? So it's always my two choices. Um, and then so through medical school, you go through these rotations, and then you realize you can't find your niche in there. And I really did like the whole sports medicine side of orthopedics. I like the interventional part. I feel like I was good with my hands. So, but I kind of knew early on that I didn't want to be a surgeon.
Mm,
Um, I still this might be a really lame answer, but I didn't like the idea of call. The
mm,
one I've had an attending when I was in medical school, he was already in his 60s. He was still taking call, and I was like, man, I don't want to live that life, right? I want to
for
be in my
sure.
60s and like not having to spend the night in the hospital. But it's probably an exaggerated example, but that's kind of like what's going through my head. And then I found, PM&R. So it was the perfect field for me because it deals a lot with musculoskeletal issues. It's non-surgical, but it's very procedural. And it's just one of these fields that when I got into it and was rotating through there, all the residents were happy. All the attendings gave a really positive vibe. And I kind of knew that that's where I wanted to be.
That's awesome. Well, for me, and most of our listeners are physicians, so they're going to know what PM&R is. But for the curious, not medical professional in the room, what does PM&R mean? And again, once you kind of got into that world, where did the passion really drive for that? Was it because of the love of sports? Was it because of the good with your hands? What really kept you there?
I think it's a combination of a lot of things too. So and then the nice thing about PM&R is that you have the ultimate cheat code, right? So
Which
for
what's that stand
me,
for? What's PM&R stand for?
it's physical medicine and rehabilitation.
Okay, physical
Um,
medicine. Gotcha.
yeah, so physical medicine rehabilitation. The nice thing about it that I really like is it's the sports medicine piece. There's a part of that. The being good with your hands, a very interventional. It's part of that too, but also it's a lot of it's anatomy, right? And
Mm,
I love anatomy. It just makes sense to me because it's everyone has the same parts. You got to make all the parts work. And
sure.
in essence, that's kind of what PM&R is. That's what physical medicine rehab is. If you actually look at the definition of physical medicine and rehabilitation, it's we specialize in function. So it's very nebulous, right? So if you think about neurologists, they specialize in brain and nerves. Orthopedics, they specialize in bones and joints. Um, Oncologists specialize in cancer and stuff like that. With PM&R, we specialize in function, which is kind of okay. What does that mean? The way I would always describe it to med students and other people is that we kind of encompass everything that makes you go from point A to point B. So anything to kind of help you there. So let's say you had a stroke. So I'm a physiatrist, somebody who specializes in PM&R. So what a physiatrist would do is help that stroke patient navigate his condition from being a stroke patient with him with a weakness on one side to be able to go back and walk better, do the things better, do his activities of daily living, and actually rehabilitate and translate from that. Another way to look at it too is somebody who has a spinal cord injury, right? So he has weakness or sometimes even paralysis because of that. Then we help them navigate that paralysis, that weakness, the disability to be able to function well back into their home environment. In a different sense, pain is also a disability. So somebody who has back pain, who, I can't do this anymore, or, can't run 5 miles anymore, but you're still able to do a lot of things. So we help them transition with this issue, whether it's addressing the pain or figuring things around that pain so that they can go back to doing their normal activities, or at least being very functional with what they have. So there's different degrees of involvement with PM&R, whether from a neurological condition all the way down to a musculoskeletal condition. I specialize in the musculoskeletal part of it. So I help a lot of patients with issues with chronic pain, and also joint issues to help them navigate what they're dealing with and what the injury is or disability, either to address that disability or injury so they can get back to normal, or at least improve it to a point that they're able to go back and do their activities of daily living.
That's awesome. That was a great explanation. Yeah, so thank you for sharing that. I think what it really boils down to is functional movement, right? Like you mentioned, the neurosurgeon is in the brain. Oncologist is about cancer, which again, inside the body. You're still working inside the body, right? Musculoskeletal, but you're focused on the movement of the body, almost to the point where it's like you can't see cancer inside someone, but there's doctors that specialize in cancer. You really are. You're the visible. You're fixing the visible attributes. You mentioned the stroke. I've met people who have had strokes before, and so like there's clearly like their movement is just impaired, right? I think is the best way to say it. And so you're enhancing that impairment, or not, you're decreasing the impairment, you're enhancing their normal movement.
Right.
Yeah. That's awesome.
Yeah.
Tell me about the Army.
It's really, yeah. So another kind of fortuitous thing with the Army too. So I've always had family in the military.
Okay.
My uncle used to be the Surgeon General of the Philippine Army, so we have that kind of bloodline. But it never really crossed my mind to join the military. But again, it's one of these things too. When I got accepted into medical school, the next issue that popped in my head is, how am I going to pay for this?
Right.
So luckily, I go on. So medical students, pre-med students talk a lot. And one of them mentioned that, you can get a scholarship from the military and they'll pay for medical school. Like, that's a great idea. So I applied for it. And then actually, before I applied to it, funny story, like I went to the local recruiting station, right? Here I am, a fourth year college student, walking to the recruiter station on my own volition, right? Just walking over there. First office I walked into was an Air Force recruiter, right? Because all the recruiters are all in one building and they have like each offices. So Air Force was the first one, for whatever reason, close to the door. I walked in. It's like, I want to be a doctor, and I need the Air Force to pay for it. What do I need to do that? So this guy was like, oh man, I don't know how that's going to work. You have to go through the Air Force Academy and you kind of go through all these things. Let me get your number, let me figure it out and I'll let you know. I'm like, okay, that's not the answer I need. So I walked the next door. Army's next. I went to the Army recruiter. This guy was more gung-ho, like, oh, yeah, we can get you in. What's your major right now? I'm like, I'm a nutrition major. Oh, yeah, we can get you into the mess hall. You can be a cook and you can kind of move up from there. And then after that, you get the GI Bill and then you can apply to medical school and all that stuff. Like, no, I'm already in college. I'm accepted in medical school. There's a scholarship that I hear that the military offers. How do I go about doing that? no, we'll get you enlisted. You get you signed up, you get enlisted, and then you're going to transition from being enlisted to becoming a doctor. I'm like, okay, that sounds really not the way I want to go because I'm already ready to jump into medical school. So I'm like, okay, thanks for the information. Here's my card. So I kind of felt like, oh man, that's a bummer. It's a dead end.
Mm-hmm.
So later on, I was kind of talking to a buddy of mine. He's going to the University of Michigan for medical school, and he mentioned that he's got something called the HPSP scholarship. It's the Health Professional Scholarship Program in the military. And he was telling me all about it. They were going to pay for his school and give him a stipend and all that stuff. And then they commissioned him as an officer. It was like, man, I went into the recruiter office and then they told me all this stuff and it doesn't sound like what you got. So he goes, oh, let me talk to my recruiter and get you linked up. So a day or so later, I got a call from this recruiter. He knows exactly what I was talking about. Like, really knows. Like, I don't have to give him anything. He told me what to do. He said, fill out this form, apply for it. You're already in medical school, so this will be easy. All it has to do is we have to fit you in the budget. The only issue is because I kind of started off late because the cycle already started. Sure. He did say that my first year of medical school is probably not going to be covered, but they'll catch the rest of it too. I'm like, okay, that's fine as long as you cover a majority of it. So that's good. So I packed up my stuff, moved to New York, and then later on, he reached out to me again. Hey, your packet was accepted, so you're now an officer. We need to swear you in and commission you. So I go, okay, cool. How do I do this? It was like, well, I can meet you in Times Square. And we could do the whole ceremony there. I'm like, oh, that's cool. All right. So met him at Times Square in this hotel room. He swore me in Times Square. It's the coolest thing ever, right? So
that's
swore
unique.
me in the military. Yeah. And then afterwards we went to the ESPN sports bar and watched a couple of games. I had a couple of drinks and then went back to class the next day. It was a cool experience. So that's how I got into the Army. It's through this health HPSP program. I'm pretty sure they still have it. They probably still have a lot of benefits. Back when I signed up, there wasn't any bonuses. I think now they do have bonuses. So any med students there or pre-med interested in signing up for the military for a free ride in med school, it's a way to go. So that kind of just opened a lot of doors for me. And just doing that scholarship, one of the trade-offs is that after you graduate from medical school, when you apply to your residency, the first 3 or 4 residencies that you should, the first 3 or 4 residencies should be military-based programs. So the military have military hospitals. The military hospitals have military residency programs, but it's everything. It's anything you can think of: pediatrics, PM&R, orthopedics, everything. The same equal curriculum that you would get from Harvard or Stanford or anywhere else. At Walter Reed, since we're in DC, our residency program is actually affiliated with a lot of local hospitals there. So National Rehab Hospital was one of it. Sinai Hospital in Baltimore, who's a part of Hopkins, is there too. So we get a lot of these nice collaborations with these other facilities. So I ranked I knew I wanted to do PM&R, ranked PM&R. I got in the Walter Reed program, which was fantastic because that's the only PM&R program in the entire military. And they only take, I think, 4 a year. So I was one of the lucky ones that got in and, had a great training over there. Just learning about musculoskeletal issues straight from high-level athletes like your soldiers, Marines, sailors, airmen. It's just a really, really fantastic experience. And I came out of that residency, ready to save the world.
That's awesome. Tell me, I'm gonna go back a little bit. Tell me a little bit about when your buddy mentioned this. I think it was HSAP. Is that
HPSP?
HPSP, acronyms everywhere. There's acronyms in every military field, and there's acronyms all over the medicine world. Yeah, it's just always acronyms. As he was telling you about that, 2 sides to my question here. First one, what did that mean to your family? I'm assuming they're still back in the Philippines. Maybe they had moved over here. What did that mean to your family to be able to get that type of scholarship, knowing, hey, a good chunk of your medical school, almost all of it, is going to be covered by the military?
So the whole family's here. So it's so we all moved.
Hmm.
Um, the so I didn't tell my mom that I was joining the army, right? I mean, I'm in college, I'm kind of independent.
She would have
So
told you
I
not
told her,
to.
right. She did. She actually, is it too late to back out? Like, no. Um, so I told her that, hey, I'm going to medical school, and I joined the military. First, like, why did you do that? But after she understood, why I did it. So it's fine. Like my dad, he was cool with it. He thought it was like a neat thing. My mom's just more worried about like what does that mean that I'm a soldier. But the nice thing is that the recruiter did a really good job explaining to my mom that and explained to me too that I'm going in there as a physician, right? So I'm a doctor. I'm still a soldier. I still have rank. I know how to fight. I know how to shoot a weapon, all that stuff. But if me as a doctor ends up returning fire, that means that we're in really big trouble, right? I mean,
Exactly. Yeah.
I'm the
You're not
last
on the
guy you
front
want there.
lines. Yeah.
Right. I'm the last guy you want there, like returning fire. Um, so that kind of help ease her mind too, and plus the whole idea of going to medical school scot free with a stipend is a phenomenal thing to have.
Yeah. Um, and obviously once you were coming out of undergrad and you knew that you were going to be going to medical school, told your parents, hey, I linked up with a few buddies. We took the MCAT, I passed it. I'm going to medical school. There's probably some pride there for them, right? They're just like, man, he's really going to go after this thing. What was it that your parents did? Did you come from a, a family that came from good means, or was it kind of a struggle? And what did becoming a physician and a soldier and then a full-time physician, what does that mean to your parents?
Yeah, it's a no. It was great. Until this day, they're very proud of kind of what I've become and what I've been. Like when I was younger, it's kind of shaky ground. Like, don't know how I'm gonna end up, but eventually it turned out okay. So I think I want to say like going through high school, I was like a B plus A minus student, on average. I kind of wasn't really exerting myself, kind of a thing. But then I guess kind of found my groove later on. But as far as so, luckily my family we're not rich, but we're okay.
Mm-hmm.
We're upper middle class family. My dad's an engineer. My mom is an executive for a big pharmaceutical company. So it's so we're comfortable. And then so getting into my parents knew that from being a Filipino and from that culture, you have to go to college. And when you go to college, you have to get a degree in science, technology, engineering, or math. Right? That's
Mm-hmm.
that's the path. Like you can't. I can't be a painter. I can't be in art in theater or something like that. That's illegal.
Yeah.
So this is kind of like expected for me to go into a professional profession. But I guess being a doctor was also kind of beyond what they expected in a way.
Mm.
I know like my parents expect a lot from me, but at the same time, like knowing how it was like growing up, and this is probably like, oh wow, okay, kind of caught them by surprise. But I guess in the back of the head, it's like, well, I guess I shouldn't be surprised because he did have some qualities and stuff like that. So they're definitely very proud. Um, the Army connection was definitely another added bonus to that. There is a family lineage of military in my father's side, so he was super happy about that. And then my mom, she totally understood it, and she was very supportive. Both of them are very supportive all the way through.
Awesome. Would you, and obviously it's the path you took, right? And so you don't know any other path, but for our listeners who either, further on in their career and they have kids that are considering getting into um, getting into medicine, going through medical school, things like that, or even for, younger doctors. I don't know how many people, that listen to the show are in residency now, but do you think the going the military route, not just from a monetary standpoint, right, having a lot of that covered, but do you
Yep.
feel like that created more of a passion for you, created more resolve in what you're doing today, or do you feel like it was just a way for me to get it paid off?
So no, so this it's yeah, it's one of these things where I think the reason I am where I am now has a lot to do with the military background.
Hmm.
So I think one of the best things that the military can do to anyone is that number one, it teaches you how to be responsible and to be mature. And I guess to break it really down further, I thought about this. What did the military do to me? It helped me gain perspective, right?
Okay.
Because, and I think it's important now, whether what stage you are in your life, to have the right perspective. Because when I came from a different background, the guy beside me came from a different background, but we're all serving in the same team with the same mission, same goal. And the way that he goes about doing things and processing things are different than the way I look at things and process things, but we're all directed towards one direction. And I think just learning how your interaction and how you learn about people from different walks of life and different backgrounds kind of gives you that perspective. So I think it helps me in medicine when I look at patients. It kind of helps me look at them at a different lens because the I was exposed to a lot of different things early on, and a lot of different experiences with other people that I think just broaden my horizons. That this is not just John Santa Ana in Michigan or John Santa Ana in the U.S. We're a citizen of the world, right? So what
Hmm.
it's beyond, and a lot of times, like, if it's not in your general local vicinity, you don't really think about it, but it gives you like a wider lens on kind of what's going on and helps you process things a little bit better. That's for me what I got out of the military. Is it gave me an opportunity to learn more about other people, other cultures, and I think it's helped me become a better person, maybe a better doctor.
New perspective. That's such a great answer. I thought you were going to say exposure, right? You're going to be able to see a lot of different things, but and I was thinking more on the treatment side of things, just because there's a lot of things that can happen in the military. But I like your idea of perspective about people as they are, right? You might not have got that, the traditional, medical school residency. You keep it all within the U.S. Uh, you might have had a very similar path to a lot of doctors, but I think your perspective of having that perspective, I think that's just such a great angle to look at it, and I think it again furthers your resolve of that you made the right choice going into the military. You made the right choice coming out and specializing in the musculoskeletal conditions and things like that you're passionate about today. It sounds like you made the right path for you. Knowing, I mean, it is the only path you had, right? But knowing the path that you have compared to others, some of those buddies that also jumped into medical school with you, I bet if I ask them the same question, they are going to answer it differently than you did.
Oh yeah, yeah.
And so I think that's what a unique dynamic that you can create for yourself um, by having the military background that you do have.
Yeah, yeah, it's like I said, and a lot of other thing too is that it opened a lot of doors for me too. It's I think just having that feather on your cap that that I served, went overseas. I'm a veteran, and I'm also a doctor. So it gives you a lot of avenues where I kind of fit in a lot of different pegs.
Yeah,
um, because I can share. There's experiences that I've shared with a lot of people, and it kind of helps make these connections.
for sure. Let's talk about the financial side of that. And so you leverage the army as a way to cover a lot of your the medical school costs, right? A lot of people don't have that, right? A lot of doctors are coming out with $250,000 of student loan debt. So we talked about your family and what it meant for you to go in and have that army, have the army cover a lot of that. Let's talk about your family today. Wife, kids.
One wife, two kids.
One
I have a
wife, two
son
kids.
who's
Yeah,
10.
hopefully one wife,
Yeah,
John.
I know, right? Yeah.
One wife, two kids. Tell me about not having the burden of student loans. As you were courting your wife, you guys got married before you started a family. What did it mean to you financially within your budget, within the planning that you've been able to do over let's say the last 20, 25 years, not having the student loan debt on the balance sheet?
it's a big deal, right? Because from just not having that in the back of your head, we knew that we can just jumpstart our lives right away.
Dollars podcast. I'm the CFO of Grand Vision Capital Group. At Grand Vision, we work with high income earners who make a great living, but still can't quite break through that true wealth ceiling. We utilize strategically chosen investments tailored for high income earners. The question always at the forefront of our minds is, why wait for retirement to finally live when you can implement an investment strategy that will impact your life today? To be honest, most of the people we work with never even knew these options existed because their financial planner doesn't have access to these exclusive investments. So, if you're ready to finally turn your high income into real wealth, visit our website, www.grandvision.co, and hit the Take Action button in the top right corner to schedule some time with me. Or even better, connect, follow me on any of my social media accounts, shoot me a message. Now, back to the show.
Right. So one of the nice things about being in the military, so one of the products of the HPSP scholarship is you have to serve 1 year for every year that the military pays for. So after I finished residency, I was physician at Madigan Army Medical Center in Tacoma, Washington. So I earned a salary as a physician there, not a lot, but enough. So that kind of helped too. And I think one of the bigger advantages of being in the military also is, as a resident, we get paid the rate of what our rank is. So I made a captain's pay. Yeah. So I made a captain's pay. With your base allowance for housing, you get COLA, which is living allowance. So you get a lot of things, benefits for that. For somebody who did not go in the military and going through residency back then, from what my friends tell me, they make about $40,000 a year. So I mean, it's enough to live on, but definitely not enough to raise a family on back then. But as a resident, if I wanted to, I was ahead in a way. Because I was making more money as a resident than a regular resident is. The trade-off is, after residency, I still make my pay as whatever rank I am, whereas the residents who become attendings get a significant jump in their income because they're now physicians. So it kind of like evens out at the end of it. But to your point of not having that debt, that another piece of negative portion in your balance sheet, that's definitely a really nice relief, getting out of that and moving on.
For sure. What advice are you going to give? And maybe you've already done it. What advice are you going to give to your two kids, as they get into high school, they go to college, they start their own lives, both personally and financially? What advice are you going to give to them?
Definitely, like I want them to find their way, right? For me, I definitely was lucky enough that I was able to find my way, and I kind of just maybe chalked it up to my upbringing, little instructions and whispers that my parents would give me that kind of led me the right path. I mean, because it wasn't all just luck, right? I mean, what do they say? Luck it's a product of opportunity and being ready, right? So I think that's it. So all I can do is like support my kids, whatever they gravitate towards, give them my full support. Hopefully I'm setting enough of a good example for them that, hey, this is the path that I took. This is where I am right now. We're able to enjoy these things because of that. You can take that route if you want to, or you can take a different route if you don't want to. But it seems like, my kids, they kind of have the love for education, which is really, really nice. We're kind of lucky that both of them really like going to school. They do well in school. They're easy to make friends. So they're still young at this point. So now we're still kind of trying to fill out where they go. But, it's at this point, I would say, like, the best advice I give them is that, go for whatever makes you happy and where you think you make a big impact in not just your life, but the world. Right. So you're only here for a short amount of time. Let's make some sort of a mark on it.
That is great advice. That's awesome. I'm gonna switch gears on you, if that's all right. We're gonna switch into sports. I know you mentioned that you're a weekend sports guy. Now, as you and I are both older, our bodies can't quite take the grind, right, in the rec gym, posting somebody up down on the block. But
Yeah.
just based on your specialty, right, musculoskeletal conditions and things like that, there's a couple athletes I want to talk about just to get your insight on what it is that they went through, what that type of treatment looks like, what recovery looks like. And then I want to finish up talking about regenerative medicine and how that plays a part in treatments for spinal injuries today. But let's first talk about my favorite athlete, Tiger Woods. He has had 4 spinal fusion surgeries in his career. 4. I thought people just had 1 and you're good. He's had 4.
Should be.
So yeah, tell us how a spinal fusion surgery is done, and then how is it that he needed 4? Is there a deterioration afterwards that you're just kind of continuing to clean up the previous mess, or is it truly they're fusing spine, working their way down, to his pelvis? So tell me a little bit about that.
Yeah. So Tiger Woods is like, he's an anomaly, right? I mean, the guy just swings the golf club like no one's business. So the amount of forces and torque that he creates is just a lot, right? So from what I obviously I don't have his medical records, but from what I
Mhm.
know, it happened to him. So he had his L5S1 disc, like the lower disc in your lumbar spine, um, is either degenerated or herniated. So the first few surgeries he's had was something called a discectomy, where they would actually go in there and actually shave off parts of the disc in order to relieve the pressure and irritation on the nerves. Because a lot of times when you have that herniation in your spine, it can pinch on the nerves that go down to your leg, and then you would either have shooting sensations down your legs, or you can have some degree of weakness on there if it becomes too advanced. So I think those are the first types of surgeries he's had to try and not have a fusion, but at least be able to still continue to play. And I think just doing that, I think twice has had a discectomy, and simply keep coming back because every time you go in there with a discectomy, the idea is you're taking off a piece of the disc. Now,
Mhm.
you need that disc. Like the disc acts as a shock absorber in your spine. So every time you take out a piece of it, that ability decreases and decreases. So the surgery that he had, the fusion that he had, is an anterior fusion. So what they end up doing is they replace the disc with a hardware in order to create that space, to replicate that space that the disc was previously occupying. But because of that hardware, the normal movement that you have between your L5 vertebra and your S1 um, decreases tremendously because before it was a functionally moving part. Now it's a solid fused piece,
Mhm.
which works great in relieving the problem at that area. Unfortunately, down the line, from what we've seen, you can have what we call adjacent segment disease, where the disc above now, your L4, L5 disc above it, and your pelvis, your sacroiliac joint, it's going to um, get the brunt of these forces that instead of being distributed all throughout that spinal segment, it's because one segment's already fused, it's just going to travel to the area above or below. And that could cause advanced degeneration and also advanced injury to those areas.
It's trying
So,
to pick up the slack. Essentially, it's got to overcompensate because of that fused piece. So
yeah,
above and below is just trying to pick up the slack essentially because he's still, even when he came back, was that shortly after like 2008, he was he was still swinging as hard as he could, right? He still had
yeah,
to
yeah,
keep up with the young golfers. Yeah.
yeah, yeah. So it's not uncommon that once you had a fusion, that you may have additional fusions later on because of adjacent diseases. You're just kind of extending that fusion part. So, um, but hopefully it's going to take some time before that happens for him. If he may, he may get that issue um, painful enough or disabling enough that he'd probably opt for another surgery, or maybe he's going to get to a point where it's just going to be stabilized to where he is. So we'll
Mhm.
keep our fingers crossed, and hopefully that's the case.
Is that discectomy? Is that a procedure that you performed before?
It is. It's a pretty straightforward procedure. So as an interventional spine physician, so I do everything through a needle. So we do everything image guidance. So we use an X-ray essentially to guide the needle into that disc, and then we use a device that actually kind of creates a small cavity in the disc to kind of relieve the pressure in that disc. So it works really well for a procedure point of view. And it's one of these things where the what we do with interventional spine is kind of give patients hopefully options to stall surgery as long as far as we can.
Gotcha. So other surgery I want to talk about, one of my other favorite athletes, but also favorite human being. He's just hilarious. But Peyton Manning.
Yeah.
While he was in Indianapolis back in 2011, he had, and I looked it up, and you actually already talked about it, cervical microdiscectomy for a pinched nerve in his neck. So I get how that happens. I remember it happening, but like I don't want to talk about necessarily Peyton Manning, but I gotta imagine that's a pretty common type of procedure that happens in non-athletes. It could range from a younger kid to a 75-year-old lady, right? That might have to have this type of procedure. Tell me a little bit about a cervical microdiscectomy and some of the I guess innovations that have come about because of it's a lot more common.
Yeah. So it's kind of similar to kind of what was a discectomy is, right? They call it microdiscectomy because it's the cervical segments is smaller. So same purpose, right? So you're trying to relieve pressure in that disc from herniating to relieve it from, pinching on a nerve. So we actually go in there and you take out a piece of the disc or so that to relieve that pressure. The So discs, I mean, the way that your spine is kind of funny, right? Because like you have a really hard bony surface, a bony substructure, and then you have this gooey kind of center, which is the disc, and then it's flanked by another hard surface. And it's through a lot of trauma, right? With twisting and also moving and stuff like that. So the discs do get degenerated a lot. So that's what a microdiscectomy does. It just kind of helps clean out that disc to relieve. The name of the game is relieving pressure off the nerve. So
Okay.
so once you kind of reduce that disc with a microdiscectomy, then you're relieving the pressure on the nerves. Then you can throw your long balls and Hail Marys. But again, what happens too is your range of motion can also be affected with that because again, you're taking off a piece of the disc. Now that cushion that you have that's this big is now this smaller.
Mm-hmm.
So everything else gets kind of compressed. It can accelerate the rate of arthritis in there too. And when you have arthritis, your range of motion suffers for that. And I think that's what eventually prompted Peyton Manning to retire, even though he was with Denver and he just won the Super Bowl. Because he wasn't the same, right? He doesn't have the same pivot that he has, looking around. And I was kind of just watching the Netflix special on quarterbacks, and Patrick Mahomes' trainer was talking about like how his range of motion in his head is so good that he can look this way and throw this way equally as well because he's like an owl. Like he's able to kind of rotate his head and rotate his body in different ways better than most. And I think, when Peyton lost that ability to do that, not being able to see so well on his blind side, not being able to scan the whole field as quickly as he could, I think that probably signaled for him that it's maybe time to move on.
For sure. Well, knock on wood, that doesn't happen to Patrick Mahomes. I'm a big Kansas City Chiefs fan. We just redid his contract. We're giving a whole bunch of guaranteed money over the next 5 years. Let's hope he continues to be an owl on the football field.
Yeah.
How often are you seeing, and obviously you're coming at it from the regenerative space, the interventional space. How often are you seeing patients come in and they'll be like, man, I got it, my neck is hurting. And this is more of a cervical thing. My lower back's hurting. It's more of a lumbar thing. How often are you seeing discs being, deteriorating, as you said?
Often. So that's probably the main reason that people come and see me. So regenerative medicine is still a pretty young field. It's been around a while. There's a lot of advances in the field now, but it's a pretty young field. So not a lot of physicians know about where it is in its capacity at this point for treating patients. Some do, but most don't. It's not something you learn in your med school curriculum. And even that to patients as well. Like patients, I think, seek out this treatment. So usually what happens is the patient is diagnosed with a degenerated disc in the cervical spine or the lumbar spine. They go through the normal algorithm. They see their primary care. primary care tells them, oh, you should do physical therapy. So they do physical therapy, they do like 6 weeks of it, and it's still there. Then the primary care will go get this MRI and then go see this orthopedic surgeon or this neurosurgeon that I know, and then he'll tell you. So the neurosurgeon or orthopedic surgeon will say, yep, you have degenerated discs. These are our options. So you can either, number one, just deal with it. Number two, we could try doing some injections with steroids to try and relieve the pain and symptoms. Or number three, if you can't deal with it anymore, come back and see me. We can do a fusion. So those are our options. So a lot of times our patients would actually, that can't be my options. They start looking at different things that they could do, and they stumble into regenerative medicine. And that's where they see us. So from a regenerative medicine point of view, the way where I see regenerative medicine fits is that it's not taking the place of surgeries and surgeons. We're kind of in the niche in between where you've maximized all your conservative non-surgical management, but you're still too good to have surgery because you're not that debilitated. You do have pain, but you're not at that point yet where you just can't deal with the pain. So that's where regenerative medicine comes in. And the whole premise of regenerative medicine is that we are using your body's natural ability to heal, and we're optimizing that ability, whether using growth factors or stem cells or anything to induce this healing cascade to that area is what we do. So for the example of somebody with a degenerated disc or herniated discs, the idea is we can inject that disc instead of with a normal discectomy. What you would do is you go into the disc and take out a piece of it in order to shrink it so it's not pinching on the nerve. The idea for regenerative medicine is instead of taking away from that disc that you need, I'm going to add into that disc and reestablish that stability and that structural integrity so that it's not going to be herniated, it's not going to be compressed. So it's more for longevity too. So that's kind of like the types of treatments that we would do for somebody. So let's say Peyton Manning comes into my office before he had his microcystectomy. That's what I probably would have offered him. Like, hey, Peyton, I can do this injection. We'll use your bone marrow stem cells, or you can use your platelet-rich plasma, which have shown to regenerate tissue and heal tissue. And what we're going to do is we're going to inject it into the disc and then cause it to repair. And then hopefully there's going to be enough of that repair that your symptoms will go away and you'll be able to go back to your normal activities.
Gotcha.
The nice thing about regenerative medicine, yeah.
I was just going to say, why, because now I'm confused. Why wouldn't a primary care say, hey, you've tried physical therapy, that failed, right? Is that the right term? You can either pass or fail out of physical therapy. Yeah. So you failed physical therapy. We can try the steroids, which essentially just mask the pain. It doesn't actually fix anything. It doesn't fix the disc. It just covers the pain from it. So go see this orthopedic surgeon. What's kind of the viewpoint or the thought process that orthopedic surgeons have? Why don't they say, hey, have you tried regenerative medicine first? Let surgery be kind of the last ditch effort. If the regenerative doesn't work, you go through the therapies, go see Dr. Santa Ana. If that fails, then we'll do surgery. Why isn't that the normal path to success?
No, that's a really good point. And I think it's because of just lack of information is one. Unfortunately, there are a lot of bad actors in the field of regenerative medicine where you're essentially selling snake oil. And I kind of tainted the word regenerative medicine and stem cells for a really, really long time. And I think a lot of physicians are still wary about that it's not real medicine or being effective. And that's one of the things that we're trying to change that culture with regenerative medicine. So one is just, lack of information or education. And again, like I said, it's not something that's taught in medical school or residency because it's a fairly new field. So unless you're really in this space, and sports medicine is kind of leading the way in this, PM&R is leading the way into this. So unless you're in those fields where we talk about it in our societies and our meetings, then you're not going to be aware of it. Your regular family practice guy, unless he really is in tune with some of this stuff, probably don't know a lot of information. They know of it, but probably not a lot of information to make that recommendation or to their patients. Not yet at this point, and hopefully that's going to grow. And I think the other big issue too is that it's not covered by insurance.
Mm.
So if I'm an orthopedic surgeon, I get paid by what I bill through the insurance. There is no, I didn't say there's no incentive, but I'm going to focus my energy on things that that my patients can bill their insurance with, right?
Mhm.
Which is injections, surgeries, medications, therapy. Regenerative medicine is not in that realm because insurance is not going to cover it. So
There's
if
not
I
a
was an
billing code
orthopedic
for
surgeon,
it.
there's not. So if I'm an
Yeah.
orthopedic surgeon, why would I spend other than because I'm a great doctor and I want to do the best for my patients. There's really not a lot of incentive for a busy orthopedic surgeon or a neurosurgeon to kind of put a lot of effort in learning about regenerative medicine because there's no not worth it for them.
Yeah. That seems wild to me. I mean, you guys, every doctor, regardless of the field that they end up going into, learns about stem cells as part of the natural part of your body, correct?
Yeah, yeah,
Yeah. And so to say you're going to be enhancing or accelerating, or your word was optimizing. I really like that word. Optimizing your body's natural way of healing itself. To me, that makes sense. I mean, obviously, I've never gone to medical school and I don't know, haven't spent a day there, right? So I don't know what all is taught, but I do know that stem cells naturally occur in your body. You can do the steroids to mask the pain, but like regenerative medicine to me just makes sense that would be. I still am on board with surgery, right? I still think that there are just a lot of things that surgery is needed. We got to go in there and fix it, right?
yeah,
But to me, it makes a lot of sense that regenerative medicine would be like the step before surgery. And so, yeah, the explanation you gave, I now have a better understanding of why that might not be the case, and why a surgeon might not say, hey, we're kind of if there's A, B, C, D, E, we're kind of step E. Like, have you done D, which is regenerative medicine? I understand that there's the politics to it, right? Health insurance
yeah.
companies are. I've talked to a lot of doctors. I've had doctors on the show that just say, hey, health insurance, they all think that they can practice medicine now.
Yeah.
There's going to be people from health insurance companies that probably watch the show, and I don't want them to think that I'm, poo-pooing on health insurance companies. But the reality is, you've spent your life doing this, right? And you've spent your life learning, meeting hundreds, thousands of patients to be able to provide, the right care for them. And I'm on a soapbox now. I'm just realizing, so I'll get off of it. But my point being, I want regenerative medicine to be in the forefront, and I'm glad that the sports medicine, that PM&R is starting to kind of gain some traction, right, and get moving. Which is certainly why I wanted to have you here today, was just to be able to talk about the advancements and some of the great trends that are happening. Because I think it needs to be more relevant in today's world. That it just becomes a common therapy, or a common thing that people think about when something happens to them.
Yeah, yeah. And like with everything new too, right? We have to prove that it works. So it all
Mhm.
comes down to that. And the only way that we as a specialty, as a field, will change minds and hearts is by proof. And there's proof out there. And so one of the things that I always tell, doctors who are wanting to go into this field or are into this field, you have to track your data. For
Mhm.
every procedure that you do, you have to put down what did you put in there, how much did you put in there, how exactly did you get the orthobiologic in there, and then what are your outcomes in a year, 3 years, because until we standardize that process, then it's always going to be just anecdotal at this point. So one of the big push that we want to do as a field is to be able to track your progress and know exactly what you're injecting. And that was one of the biggest pitfalls with regenerative medicine early on, is that you know anyone can just say like, oh, I'm injecting you with stem cells and PRP, but are you really, right? I know
Mhm.
you drew the blood from me and then you put it in a centrifuge and you inject it back. It's probably PRP, but how do you know, right? Without knowing what's in that syringe and quantifying that dose, you don't know. So now we know now that the reason why PRP studies before and stem cell studies before were not that effective, or it's all over the board. Some work, some don't. is because dose matters. Like in any drug or any medication, the dose matters. So now we are pushing towards that. Whatever you do, whether it's if you're going to see a regenerative medicine doctor, just make sure that they have the right dosing for it. So just looking at literature, you want to have at least, for doing PRP, you want to have at least 4 billion platelets per milliliter when you inject it back, or better, right? So in our
Mm-hmm.
lab, we consistently get, double, if not triple that amount for our platelets. So that kind of gives us a better guarantee it's going to work. So the best analogy is to say you have a headache, and you can take a Tylenol, but you can take, 100 milligram Tylenol, which probably is not going to work for your headache, versus
Mm-hmm.
taking a really good 500 milligram, 600 milligram dose of Tylenol, which is probably going to work much, much better. So the same thing with your orthobiologics. Without knowing what you're injecting, then that kind of where the variability comes. And then the second part of that too is, recording your outcomes. You need to be able to track your outcomes, so that when patient comes to my door and say, "Hey, Dr. Santa Ana, I have this degenerated disc. What options are you giving me?" Well, I can give you this treatment. This is how effective it is. I can give you this treatment. It's effective it is. Or I can give you this treatment, and from the hundreds of patients I've seen, 1,000 patients I've seen, these are my outcomes. So that kind of helps everyone have a more informed decision. So it's all informatics, right? So it's everyone just giving them the tools to make the right decision that's going to work the best for them.
Sure. And so as you're gathering this data, and all the other doctors in the field of regenerative medicine are gathering this data, that's going to allow it to become more relevant and more pronounced within the medical community to say, hey, we have all this data now. This is so new, but we've gathered all this data, and here's, dosing matters, timing matters. Somebody who has a certain number of doses, after a while, they stop coming to us, right? The pain has gone away, the treatment has worked. And so it sounds like right now you guys are in the data gathering stage of regenerative medicine, which, many other forms of medicine and treatment, dealt with that years and decades ago. And you guys are just in that now, which has got to be exciting for you to say, hey, you're in the forefront of this treatment plan that can become more well-known and more common. You're part of it. You're a data gatherer right now.
Yeah, it is. And I think that's the crucial step for us to move forward away from a cash-based type of a procedure to something that's going to be accepted by insurances. Mm-hmm. So if we can show insurances like, hey, these are diagnoses, these are the treatments that we do, these are our outcomes, and there you go. It's whether you believe it or not, it's the data is there. And I think that's the steps that we have to take in order to really legitimize this field and get broader acceptance, and hopefully being covered by some insurances at some point.
Yeah, for sure. The fact that you're able to go cash based is great. That leads me to assume then that stem cell or PRP, whatever treatment it is based on the patient, these procedures, or these I don't want to say procedures, it's non-invasive, right? So it's these treatments are less of a cost to the patient than, say, a traditional surgery. Because I mean, a surgery out of pocket cash based would be pretty expensive. If I remember, I haven't had surgery in a long time. So do you think that will be part of what makes this cutting edge and more common, is just from a cost perspective, it is more reasonable for patients to be able to go through this type of thing?
Yeah, I think so, because you're right. Like the cost of any type of surgeries is astronomical. And the cost for doing, because it's not just the surgery too, right? It's the hospital stay, the rehabilitation that comes after that, and the time off work that you're going to have, that your company will have to shoulder for that. So with regenerative medicine, it's the same day procedure. You walk out of the clinic the same day. The recovery is much, much quicker, and then you're usually back to work within like a few weeks to a month. So it's from that perspective, just from an overhead point of view and even post-care point of view, it's definitely makes more financial sense to do it.
Do you think a little bit of your passion, I'm going to go a little bit deeper now, but do you think a little bit of your passion behind regenerative medicine may be because, not just patient care and being able to solve their pain ailment or whatever it is that's, causing them discomfort, but do you think part of your passion behind regenerative medicine is because it is more cost effective, and it doesn't take someone half their savings account to pay for this. It doesn't take someone out of work for 6 weeks. Maybe it's only a week or two. It creates a better quality of life for your patients. That truly is part of their care. Do you think that's what really drives some of this?
Yeah, I believe so. It is, kind of being in rehab medicine, and kind of dealing with function and also with pain management. You kind of see with pain management, you kind of see this revolving door of patients. They come in, you give them an injection with a steroid, they get better, and then after a few months they come back and do the same thing. And with regenerative medicine, you're kind of giving them an escape from this hamster wheel of coming back. And like my patients, they're regular guys like you and me, right? I mean, they go to work, they take care of their kids, they need to go to work in order to make money to take care of their kids. So the the faster I can get them from not being able to work or do things within their ability or outside their ability, the better it's going to be.
Mm-hmm. Yeah, so you made a good point there. So a lot of the people that you're seeing, I would say probably a majority or all of the people that you're seeing are regular guys like you and me.
Yeah.
The day-to-day is spent in that world. So just the nature of that business as far as who's experiencing these injuries, and that's what you specialize in. Tell me about the passion behind that. Like it'd be cool to work with a Peyton Manning or a Tiger Woods, right?
Yeah. Right.
But how often are you seeing the answer is probably all the time, but the construction worker coming in that truly regenerative medicine is going to help them? Or is it the 75-year-old grandma who is just, she has natural deterioration and this is just a therapy that's going to help longevity for her from a physical standpoint? What's kind of that dynamic that you're seeing, and where's regenerative medicine really helping people the most?
So we see that whole spread of patients. So we have college athletes, high school kids in recreational leagues and travel leagues, to your construction workers, line workers, executives, retirees, newly retirees, retired for a while retirees. We see all of them, right? Because one way or another, their injuries all boil down to a sports injury somehow. They sprained their knee, or they've had this back issue, or they're playing pickleball and they hurt their shoulder. So even though they're not being paid to play these sports, they're still actively in there, right? So and not just sports, like somebody who kind of has to swing a hammer all the time, right? That's like a repetitive type of injury, and it's a very physical type of a job. So those are the types of patients that we see a lot. And the nice thing about regenerative medicine is that I always tell my patients, the thing about regenerative medicine is that it works all the time. Like your body is going to heal you all the time. The question, the variable is how much of that improvement is it going to be? Is it going to be a significant 85, 90% improvement? Or is it going to be, a 50% improvement or just a little bit? And depending on where you are and what you do, that's kind of like your goal. So my older population, 80 plus, 70 plus patients, you're right. What they want to do is be able to maintain their current level of function so they can, do what they love to do. So that's what their goals are. Somebody who's mid-career, all they want to do is be able to go back to work and do what they want to do. So that's what their goals are. Somebody who's younger, they or into sports and stuff like that, they want to get better 100%. So there's a different kind of goal and mindset. The nice thing is, like the younger patients, the healthier. So the two things that we look for as far as regenerative medicine and what your outcomes are going to be is how healthy you are. So the younger, the healthier you are, those athletes, great stem cells, great healing mechanism in their body. They're almost always going to do very, very well. And then the second thing is how severe is the injury. So the younger patients, usually their injuries are a little bit more advanced, right? Because they kind of get into all kinds of stuff. But the older population, even though they're not as healthy as a younger person, their injuries are usually not as severe because it's usually from wear and tear, sprains, strains, stuff like that. So it's you kind of like tailor it depending on kind of what the goals are. But the goal is trying to get the most out of it from what you can give to your patients.
That's awesome. Really, I mean, it sounds like, and this is again similar to what I do And what me and my partners do with Grand Vision Capital and how we leverage, these exclusive investment strategies. Our whole goal is like to give physicians back their time, right? Allow them to create passive income, allow them to do all these things today that will impact it and give them more time back. And so it sounds like in the medical world and what you're doing is you're giving these people more time back. To go from an invasive surgery that has 6 weeks of rehab and recovery, the time away from work, these athletes, the time out of sports, right? If something bad happens and now they've missed half the season because they went through a surgery, you're now giving them time back in a more cost-effective way and a less invasive way.
Yeah. Yeah.
Sounds like we're both just giving time back. We're just handing out clocks.
Yeah.
That's all we're doing.
Yeah, that's right. Yeah. Yeah.
Awesome. Last question for you. What do you think is the next big thing? What do you think is going to be the cutting edge innovation within regenerative medicine? I've also heard it called orthobiologics, which I think is a cool word. What do you think is that next big innovation in your field?
So this is all not based on anything, but I think the next evolution would be probably being able to replicate a tissue that's broken. So let's say you have like that disc example that we have. So let's say that disc is degenerated so much that I think the next evolution to that is being able to actually get that disc, grow it in a lab, and then put it right back where that's injured and replaced, or the original replace it. So I think that's probably where the future of where orthobiologics and maybe surgery is going to go, where we're going to start creating these replaceable parts from you, not like it's not a synthetic, but from you and I. So it's going to have the same protein, same information that it's replacing. That would be really neat.
Yeah, kind of like replacing a tire that's just become worn down over time, and it's like, hey, we can take that one tire off and put a new one on.
Right.
You're essentially
same
saying it's
brand,
the same type
same
of
model.
thing.
Yeah, yeah, exactly.
Yeah, so to be able to do that in a lab with their own tissue, proteins are the same, everything lines up, the body doesn't reject it, right?
Yeah.
I know that was a big thing. I had a friend that had a really kind of a major surgery when you're younger. Is like the body can reject things that get put into your body through surgery, right? And so I think orthobiologics, I'm going to start saying that word now instead of regenerative, just because regenerative is sometimes hard to say when you're trying to say it fast. So orthobiologics, I think that's really cool that you're able to lab grown your own stuff, throw it back in there, and you're just enhancing and again, creating more longevity with the spine and with other parts of your body that you're able to do that.
Yeah. Because the mechanics are going to be exactly the same. Not like with a fusion or a hardware, it kind of throws off the mechanics of it. But your mechanics are kind of exactly the way that you learned how to use it your entire life.
For sure. Going back to that overcompensation, your body doesn't have to overcompensate when something's in there. And you said it earlier, like it's that squishy stuff in between your vertebrae. Yeah. So it's like if it's still squishy, we're not locking that in place where it's more immobile. It's just going to create a better lifestyle. So that's awesome. Well, John, I appreciate you being on the show today. This has been a great conversation. Anything else but you want to throw out there before I let you go?
No, I want to thank you for having me over. I mean, I think this is a great platform that you created, and then it's sharing a lot of information for others, and hopefully people can get something out of it.
I agree. Well, appreciate you having you on. Hopefully we'll have you back later down the road when those big innovations do start coming and you're at the forefront. You're the leader in that field. So look forward to having you back at some point in the future.
All right. Awesome.
Yep. Thanks, John.
Bye.
Hey, everyone. As we wrap up today's episode, I want to talk about the second opinion. As most of our listeners are physicians, you guys know the importance of having another medical professional's insight for a patient's treatment plan. But have you ever considered having a second opinion on your financial plan? Or have you simply trusted your financial advisor that they've already leveraged every strategy that your family needs to be 100% on track to meet your financial goals? That's why for my Doctors and Dollars listeners, each Wednesday I block off 3 time slots, an hour each, to provide a free second opinion of their financial plan. During this hour, we'll reevaluate your financial goals and your risk tolerance. We'll ensure tax mitigation strategies are in place, and ultimately give you confidence with your financial outlook, because that is what drives a happy home, a happy marriage, and peace of mind. These 3 spots each Wednesday do fill up fast. Send me an email at nate@grandvision.co or head over to www.grandvision.co/second opinion to fill out a quick form about you and schedule a time for us to meet. Thanks for tuning in, and I hope the rest of your week is abundant. Cheers.